Hello and welcome to the Healthy Mothers, Healthy Babies Consortium, titled Accelerating the Global Multiple Micronutrient Supplementation Market, Why Product Quality Standards and Delivery Data Matter. We are so honored to have you today. We know you've taken time out of your busy schedules to join us, and we don't take it for granted. Now, today we have lined up two highly experienced speakers, both of them working for UNICEF and also friends and career friends, I might add. So the first speaker is going to be Gemma Orta-Martinez. Gemma is the Chief Monitoring, Strategic Data and Evidence person at UNICEF Supply Division. She has extensive experience leading multicultural teams to deliver supply chain information and evidence for decision-making in both humanitarian and development contexts. And Gemma's work centers around transformation of complex supply chain data into digitally accessible insights that support planning, collaboration, market transparency, both for partners and country governments. So as you can imagine, her work is very important for the MMS conversation. And today, she will spotlight UNICEF's interactive multiple micronutrient supplementation market dashboard, which showcases real-time data on MMS supply, delivery across countries to support better decision-making. Our second speaker is going to be Alison Fleet. I think you have met Alison Fleet in previous presentations, but just as a reminder, Alison is a technical manager with UNICEF Supply Division. She has over 20 years experience in the formulation of products, product development, compliance in nutrition and product management from both the private and public health sectors. She is known for her work in scaling up of nutritional products for development and humanitarian use. She has recently led the text completion of the Codex guideline for ready-to-use therapeutic foods and has also developed several other product specifications used for international standards. Today, Alison will share insights on UNICEF's new UNIMAP MMS product quality standards, which are designed to improve product consistency and quality at scale. Before we start our conversation, I want to give you some of the housekeeping guidelines for today's coffee and chai chat. They're already on your screen. So I want to invite you to write your name and affiliation in the Zoom window and turn on your video. All participants will be muted during the presentation, but will be able to unmute themselves during the question and answer session. Please, when that time comes, raise up your hand if you would like to ask your question. This is a coffee and chai chat, and so although it takes a webinar format, we like to keep it very informal. You can put on your video and raise up your hand and ask your question yourself. Or you can write your question in the chat box, and then our team will, or myself, will read it out to the speakers and have it answered. In the course of the meeting, if you develop any technical difficulties, you can send a direct message to tech support. They are online and they are ready to support you so that you can get back online as much as possible. And just for those who registered for the meeting and are not able to join, we record this meeting and the links will be available post the meeting for them to view back. And the recording link will also be shared. There'll be lots of links shared in the chat, so feel free to click some of them as the conversation continues, interact with the documents that are being shared, and ask questions in real life, in real time. With that, I want to now welcome Gemma to continue with the next part of the presentation. Gemma, over to you.
Thank you. Thank you, Martin, and hello to everybody. It is really a pleasure to be here with you today. My name is Gemma Orta-Martinez, and Martin introduced me, and I am working at UNICEF Supply Division. And today we are going to be talking about a couple of topics that seem to be seemingly, I think for most people, they seem a little bit unrelated. But in fact, they are framed in the UNICEF approach to market influencing. So when we are saying market influencing, in reality, what we are doing is to try to see how we can work with markets in a way that can help them become more affordable, more reliable, more innovative, able to meet the quality standards that we are expecting, and really respond to the situations and to the needs that we have in the countries. This is particularly relevant on when we work with markets which are very thin, that is, there is very few suppliers, or in markets that are very underserved, where there is a demand, but we're not able to meet with the supply that is there, or markets that are very fragile. And the way in which we are working is that we are looking at the underlying causes that that create the situation in a market by engaging the suppliers, by engaging the buyers, by engaging the donors, by engaging the policymakers, and really all of the stakeholders that may be relevant in a market. And for this, we use tools such as forecasting. So by generating a forecast, we are able to identify, to have this information, and then we are able to transparently share this information with our suppliers, for example, with the donors, with the countries, pooling demand. That is gathering the demand that there may be individually in various countries, pulling it together so that we make a market much more attractive, offering long-term commitments to suppliers so that they have a security that they can use to either talk to their shareholders or actually decide on investing in a particular area. Transparently share this information, as I was saying, setting the standards, including the quality standards, and having also quality assurance mechanisms that make the suppliers feel that they are playing in a leveled ground. For example, if we establish quality levels, that can help the supplier say, okay, I meet this, I am therefore suitable to work in this market and suitable to work with UNICEF and other organizations that are affiliated to UNICEF, and also that they know that there is a fairness in how the price and everything else is going to be assessed. So that is where, and I think that you started to guess, that is where today we are going to talk to you on two of these tools that we are using in the MMS market. So the multiple micronutrient supplements, as you know, is a product that is relatively new, and also that is trying to really encourage the use of this product across different countries, and also encourage the supplier base to actually grow and, as much as possible, have suppliers that are closer to the countries where the need is. So for this, we are going to talk about two topics. One is our nutrition market dashboard, and the second topic is the quality standards, which Alison, my colleague, will be talking about. But first, I'm going to talk about the nutrition market dashboard. And for that, thank you, I am going to share my screen. One second here, sharing my screen. Let's see if that is going to work. Share. Yes, that is working. You are seeing it well. Yes. So this is in the public domain, unicef.org. We have the supply nutrition market dashboard. And this is let me just go to the introduction. This is so there is some information and some resources about the various aspects of that relate to nutrition that UNICEF works on. But we have a particular for today, there is an RUTF, but particularly for today, we're interested in the multiple micronutrient supplement, MMS. So when we focus on this area, we are looking at this landing page, but also two pieces of information that we're looking at. First of all, on this landing page, we have some key pieces of information. How many MMS tablets we
can't see the dashboard.
Excuse me?
We can't see the dashboard.
Oh, can you not see it? Oh,
No.
Thank you for letting me know. I'm just, it really didn't work. Let me just figure it out where my mouse is here. I'm gonna.
We can see your screen though, so it's
yes,
just
but you can see the wrong screen now. I can see it. Let me stop sharing. Apologies for that, colleagues. I don't normally work with multiple screen, and now you can sense that I don't normally work with multiple screen. Let me see though, here, this one. Share. I think you are seeing the right one now. That is correct. Yes, correct. Thank you. Thank you for letting me know. Good. So I start again. So this is in the public domain, and this is the landing page that I was talking about, where we have information on RUTF and where we have information on MMS. So going into the MMS, as I was going, here we can see this landing page that provides these key pieces of information. So how many, somebody writing on my screen?
Oh.
Okay. That's funny. Okay, thank you.
I don't know.
Yes. So we have the various years of information. So 2024, how many tablets UNICEF secured and how many tablets were delivered to how many countries in support of a supplemental diet of how many women. And then we see 2024, 2025, there is already an increase, and 2026 for now, we are at 2.7, practically, 2.8 million women that we have been able to support, given the number of tablets that have been delivered to these 14 countries. So this is just the key figures, but also to show the breadth of the information. And you can already sense, you can already sense that we are, by providing this information, we are giving an overview to the suppliers. What is the size of the market that we're talking about? Is there a growth market that year on year we have growth, or where are we at? Another key piece of information that we're providing is this programmatic insights. Now, this is based on 22 countries that responded to survey, programmatic survey that UNICEF does every year. So we are talking about the data year that we're looking at is 2024, and we are soon going to be able to upload the 2025 data. And here we asked countries key questions that can show whether or not they are in the pathway to start utilizing MMS. And if they start utilizing MMS, what type of MMS are they utilizing? So we can see here 22 countries, the list is here, and the answer is very simple. So 48 countries have 48% of the countries have indicated that they have included MMS in their essential medicine list. Also, 28% of these countries are indicating that they have a costed plan to the scale up of MMS to pregnant women. And then here in the middle, we can see the countries, what type of formulation they are using. So 72% of the countries that responded are actually supporting the UNIMAP type of MMS, the formulation of the MMS, which is something that my colleague is going to be talking about. So we have the information here per country. So Afghanistan, they have included it in the essential medicine list, but they don't have actually a costed plan. So that gives an indication of what is the if you were a supplier that want to work in Afghanistan, that can give you an indication, or that you want to produce, for example, in Afghanistan, that can give you an indication of what is it that you could be finding there. And if you are, for example, in the DRC, you can also see that DRC is using various formulations beyond the UNIMAP. So there is a variety of information that you can get with this type of programmatic insights. And then we go on to the delivery onto the delivery information, which is really looking at how many countries has UNICEF delivered MMS to. So it is 38, and then how much of these tablets have been procured from suppliers, how much are on the have been made available for shipment, how much are today in shipment and so on the way to their destination country, and how much of MMS has already arrived to the countries. And so the information can be filtered obviously per country. So if we're looking at Yemen, we can see what is the status of the Yemen. So we can see that Yemen is pending to be receiving still some of the tablets for this year. And then we have the information also in a variety of ways. So for example, per country, if we are looking at, I am looking at all of the countries, if we were to I was looking at Afghanistan right before, right? So we can see here, so when is it that Afghanistan delivered? I put it in order. So Afghanistan started receiving MMS in April 2024 and has been regularly receiving, except that the last time when they received was in June 25, right? And so if we are looking at another country, for example, I'm going to look at Nigeria, here, Nigeria. We can see again how much have they received thus far. Obviously, that doesn't. And then when did they start receiving in January 24? And so when did they last receive in May? We have the information as well per month, either via a table or with a visual of we're still looking at Nigeria. So there is a variety of sources of information, and then we're looking at the tablets delivered and the women that are being targeted, right, per country. So this is the information that we are making available to everybody, both the governments themselves, the donors that may be looking at supporting a country or supporting in general the MMS, the suppliers and any other stakeholders in the area of nutrition that may be interested in having this information, and then from this information, deciding making their own decisions as to what type of investments or what type of focus they want to give to the information, to the MMS, to their MMS engagement. So I am going to stop here and hand over to my colleague, Alison, who is likely ready. I will, of course, stay here for any questions later, as indicated by Martin. Thanks.
Thank you. Can everyone hear me? Yes, great.
Yes,
so
we
thank
can
you so
hear
much.
you.
Excellent. Thank you so much, Gemma. So I really hope that now that the group here can see that dashboard, it really is a rich source of information, both programmatic as well as supplies. I really encourage you to go to our website and click on that, because you'll find a ready portal for lots of data points that are very helpful. As we have a lot of people here, I know, that are interested in and working in this maternal nutrition scale-up initiative. And so now to just transition to what I wanted to share with you today, which is really talking about something that you might not have thought as being really important. But we here in Supply Division, we've been working together with partners to look at the product standards. And why is that important? I think the reason why this is important is because as a group where we have this really, together we have this really key objective to scale up maternal nutrition programs that use MMS. And because we have that overall aim to reduce mortality and also to reduce anemia in pregnant women globally, we need a single global recognised quality framework for the manufacturing, testing, packaging and labelling of the one formula that we know has got the science-backed formula, which is the UNIMAP. And so we really are keeping the pregnant women and breastfeeding women at the heart of that work that we've been doing. So we have developed these standards that are trusted and recognised by governments and manufacturers and donors, because we think that it's a key enabler to ensure that programs are successful. Next slide. So what do we do? What is the work that we have done and what products have we got? So we have detailed technical specifications for the tablets that are in the bottles that you've been programming. So we have stipulated the shelf life. We have stipulated the testing requirements that really check on compliance for all those nutrients that are in the product. We've also detailed about the acceptance limits. We've detailed about the tests that should be used to give a consistent result, the assays, the impurities, the physical characteristics of the product, the finished product, as well as what kind of ingredients go into the product in the first place. And then we worked with partners to really align on the packaging and the labelling so that we agreed on the same messages. across the board with all manufacturers that we're working with. So what we have worked on is to really look at the manufacturing standards. So who is going to make these products for us globally? And we agreed that we wanted to use the WHO manufacturing, the GMP guidelines as a baseline. So that means that we expect most manufacturers will have to comply with pharmaceutical grade standards in their facility in order to make this product. So it's a very nice high level standard which is going to ensure quality. And as I mentioned before, we have unified labeling requirements, and we also have the unified way to assess shelf life, because that means then we can be guaranteed that the products in this product, the tablets in the product, keep to their shelf life at the very end. Every single tablet will release the folic acid when it should. It will make sure that the right level of iron and iodine, all those key nutrients that we know that growing babies need, will be delivered, doesn't matter what point in their shelf life of the bottle. Next slide. We also have a second document. So the first one is the technical specifications that have been revised and agreed upon. And then the second document that we have produced is called the Technical Requirements for Micronutrients Products. So this is actually a UNICEF document, but it applies to all of the micronutrient supplements that we supply through our division. But the key area here is that we really revamped that document to incorporate key requirements for MMS. So that it's an overarching framework that defines manufacturing standards for all micronutrient products that UNICEF supplies. So it details composition and manufacturing. It also talks about testing and stability, and then packaging, labeling, and documentation. And we also have other areas in that document around things like shipping. And so it's very comprehensive. Next slide. So as I mentioned, why is this UNIMAP standards? Why is it important? So we know that this multivitamin has got 15 active ingredients, and that's what the formulation is comprised of, that UNIMAP formulation. So it's actually quite complex to make. It's not an easy one API medicine that would be a standard product for, so antibiotics or something like that. We've got 15 different nutrients, and they all can interact with each other, and they have to survive the shelf life of a minimum of 24 months. And so we really need to mitigate the risk of inconsistent or substandard product quality. And so because of that, we have a very key goal to harmonise those expectations across manufacturers. And we also want to ensure that regulators and national procurers are aware of those standards as well. Because in the end, what we're really thinking about is that pregnant women and breastfeeding women that are taking those tablets. Globally, we want to really make sure that they are well looked after and are all consuming good quality products. So we don't want to compromise the quality. Next slide. So why are we sort of sharing this information now in this coffee and chai chat? So as more countries integrate UNIMAP MMS into their national antenatal care programs and manufacturers scale up production, it's really important that we ensure consistent high quality standards across all products. So without those unified standards, the different manufacturers may end up producing products that vary in their quality and their safety and their composition, and that will create some uncertainty for pregnant women, the governments that might be buying those products, and really we are depending on those manufacturers to be consistent and high quality. So we also want the product quality from different manufacturers to be viewed as interchangeable, because as we scale up, when working with more than manufacturers in more than one different context, we want to really feel confident that all those products, no matter where they're made, meet the same technical requirements and specifications for UNIMAP MMS. So in summary, the interchangeability accelerates the scale up of this critical maternal health intervention because it streamlines the supply chains, it reduces procurement complexity, and it also will, in the end, improve cost efficiency, which is also key because we really want support for this in the long term, and that means it has to be affordable. Next slide. So what about the product labelling? Well, we can see that we have a recognisable label there with the UNIMAP name as well as their logo. Next slide. That's it. So I just want to say, going back to that last slide, I wanted to share with you that we have we've worked on a consistent labelling, and we really want MMS to be recognised by this pink lady, as we're calling it, because she symbolises good quality MMS. Okay, over to you, Martin.
Thank you so much, Alison. Always nice to hear from you about this product, and especially about UNIMAP MMS. So now we are going to the next session or next part of our Coffee and Chai chat. And the audience now has the opportunity to ask questions to our speakers today. Remember, you can either type your questions in the chat box or raise your hand. Feel free to open your video or put on your video, make it interactive. Once your name is called, please unmute yourself and ask your question. So I will start with the first question, and I think the first question is directed at Gemma. Gemma, the question is, what are the primary barriers preventing countries from scaling up MMS distribution, and how does the MMS dashboard that you presented help address them? Over to you, Gemma.
Thank you, Martin, and thank you to those that asked this question. Yeah, so there are, as of today, the barriers that we are finding was one, this issue of the quality, right, which now we are addressing via these quality standards that we have presented today. That is, there has been many situations in countries where women were starting to use some supplemental micronutrients, but they may not have been at the quality standard that we are now putting forward with the UNIMAP. The second element is also the actual demand from the countries. So there is two types of demand. There is one type of demand that is like individual women who can actually afford to buy these tablets by themselves or via the family budget. And then there is the access that is provided via the public services of the various countries. And in this, and in any case, and in both cases, it requires that the demand from the women and the families themselves, particularly from the women, grows, that they become aware that this is a product that is suitable for them in their situation as pregnant women, and that this is something that they can be expecting to be provided, or that they can be expecting to be accessing via their health services. So that creation of that population demand, you can say, that then translates into the government authorities that say, okay, we are going to actually be providing this product. I think that those two elements are today some barriers to accessing the MMS. We have been doing some work with suppliers, and there are suppliers, I could see in the chat that we have some suppliers that have joined, right? There are suppliers that today are producing to a level that we can actually meet the demand that there is. What is our focus is on growing that demand so that more women know about this product and more women can actually access this product, either because they can buy it themselves or because their governments provide this to them in the health facilities where they attend. I will stop here.
Thank you. A follow-up question from Faustina Minta. She's asking, is the market dashboard only tracking MMS procured by UNICEF? If not, how does a country's MMS procurement get featured on the dashboard?
Yes, Faustina, thank you very much for this question. And actually, this is very good, because at the moment the dashboard is only showing what has been procured and delivered to the countries via UNICEF. However, if there is and at the moment we are not able to access the information from other countries. However, we have some experiences in the past where the countries have wanted to be shown as also providing this product to their populations and have submitted this data to us so that we can also provide it in this consolidated and aggregated view. So if there is a wish from countries and from other buyers to actually consolidate this information, this is something that we can do, at which point it becomes being just a UNICEF product that is online, but also I don't know if we can call it like a kind of public good that is providing information across a variety of buyers to really provide the picture to the suppliers. Because one element that is very important is how this visibility is guiding governments to see, oh, my neighboring country is doing this, should I also do that? And how that visibility is providing the suppliers the tools that they need to really match with their supply the demand that may be available. So that it would be a very good point, Faustina, if we went to go in that direction. Thank you.
Thank you. So as I ask our second presenter to also put on her video, there's a question for her, Alison. I want to also request Amadouali Amini, if it's okay with you to ask your question yourself, if you feel okay to put on your video and ask your question. Otherwise, I can also ask it for you. In the meantime, Alison, there is a question for you. What steps can national decision makers, donors, and NGOs take to help amplify and advance the UNIMAP MMS product standards? And what's in it for them?
Well, they can start to adopt the standards that we worked into their own national guidelines for procurement. And we would be more than happy to support them in that endeavour. It's really, really close to everyone that has, I mean, we've sort of been working on this for 1 year with partners, and it's so close to our heart that we have high quality MMS that can really deliver those micronutrients to prevent neural tube defects, prevent iodine deficiency, prevent anemia. We really want to deliver those nutrients. So we would be happy to help national governments to help move those standards into their national guidelines, just as we've done with RUTF and some other commodities that are used in nutrition programs. So that's and what's in it for them? So what's in it for the national regulators is that all the hard work in determining the quality standards has been done. And in addition to that, we also have an ongoing sort of initiative and program, UNICEF, where we're working with local suppliers to really get local suppliers to make that product. So for us, this is the beginning of that journey. We need the standards first, and then we're in a much better position to really support local suppliers to implement those standards in the right way. So that's what's in it for the national governments. They have an opportunity to use that work to incorporate that into their own daily work with implementing standards. And then plus they have an opportunity to sort of use that ongoing program of work that we have right now to really support local manufacturing.
Thank you so much, Alison. Amadouali, I mean, go ahead.
Yes, thank you, and good morning and good afternoon. So this is Amadouali Amini from UNICEF Afghanistan. So, and thank you for the nice elaboration and also information. Although we are using the MMS in Afghanistan with the Kirk and also with the UNIMASIN in the previous, so there was an issue. But overall, according to the Afghanistan law, medicine law, so the label should be written even in local language and also one of international languages is English. It is fine. So if we ordered the MMS and we requested the suppliers to add the local language along with the English on MMS, Is it possible to have the same labeling with adding the local language on that, with keeping the 15 micronutrients still in the pack? Over.
We have had some countries request this, and so we have to really be careful with weighing up like lots of different language requests and the price going up versus keeping the price moderate so that we can reach women. So one of the solutions that we had for this is to create a QR code on the label, so that all you need to do is scan the QR code, and then on your phone you'll have the language that you require. We have a lot of different translations already done, so it is possible. If we don't have, I think is it Farsi in Afghanistan? I think it's Farsi that you speak in Afghanistan. So we can make sure that there is a Farsi translation. I hope, would that be adequate for your context?
Yeah, so we are having two local language, Dari and Pashto. Anyone with is available, that's fine.
Yeah,
but
we can.
the difficulty is that in most of the remote areas, so the people may not have the access to internet to verify that. But anyhow, that will help us at least during the process for the quality control, and also the further process that may be highlighted with the lab there, so that will be not an issue for the clarifying and also for the clarification process.
So we'd be really happy. I mean, we're in the same team, we're in UNICEF, so please write to our team and we can support with making sure that you have those language translations as part of the QR code, and then we can definitely continue that dialogue.
Thank you, Alison. And just to just to emphasize that point about that there are already some languages available in the current bottles, and the scanning that Alison mentioned can also be done just using your mobile phone. You don't need complicated equipment for that. But then I believe the conversation around other languages can be handled by Alison in another contact point.
It's not limited. You can have as many languages as you like in that QR code. So that's really the great thing about that. Yeah. Nice.
So there are a couple of other questions that have come in. Louis Ngoma has asked a question about, I believe this might be for Gemma. How can we improve the data to show all MMS? I believe this is on the dashboard, to show all MMS supplied in the country. That's a question. And can we develop a system to capture all the supplies in country with support from UNICEF? Gemma, do you want to give your thoughts on this?
Thank you. And I could see the colleague who is asking, I believe it's from Malawi. So it is, at the moment, there are very few partners that are delivering MMS to the various countries. So I would say that there is a possibility of having an agreement with those partners that actually deliver, or if it is the government that is buying by themselves. But I think in many cases, when the government is procuring, they are procuring through UNICEF, including as we are having this financial support for the governments who fund via their own domestic funding the MMS. So there is the possibility of having an agreement. For example, we know that there are in some countries Vitamin Angels are providing the MMS. So there is the possibility, and we have discussed with some of these partners to actually join the information so that the collection of the information, you don't need to do it at the country level, but that can be done at the partner level. But I think that this is something that if there is an interest, we could discuss further, because the more that we aggregate it so that partners that provide the MMS or that deliver the MMS to the countries can, as early as possible, provide this information and UNICEF aggregates it, that would be the easiest than having to then each country have to provide the information of the supplies that they have received. That is also an option, but it may be more efficient to do it earlier on. So that is an option. bottom line, yes. We just need to see if there is real interest for this, and we can work on that.
Okay. And then there is another question from Kirsten Itliong from the Philippines. I want to see whether he or she can unmute and ask the question to the speakers. In the meantime, I have a question about whether manufacturers in LMICs can be supported to achieve the standards presented by Alison, and whether there are resources available to them. Alison, do you want to weigh in on this?
Yes, sure. I mean, we've been working, we have a really, with partners, we have a strategic plan to have just the right number of manufacturers globally so that we can reach the women who are using who are part of programs in national governments. But we don't want small suppliers producing low volumes that are expensive. So we have to balance how many suppliers we actually have in the global supply chain so that we can keep the product as close as we can to the iron and folic acid cost that they had already allocated budgets to. So you can see that we've really worked on this very carefully with partners, and this is the guiding sort of North Star that we have. So yes, we do want manufacturers in some low-income countries, but if we have manufacturers in lots of different low-income countries, then we can't pool those volumes, which is what Gemma was sort of touching on in the beginning of her presentation. And if we can't pool the volumes and the manufacturers don't have efficiencies, and therefore their price ends up being high. And we've seen that in our tenders. We have seen prices very high. It's not going to work viably. It won't be viable. But if those manufacturers can have big volumes where they can really get efficiencies through the volumes, then we can keep that price at the sweet spot.
And I believe for the non-manufacturers like me in the room, basically the reason why we want to keep the cost as low as possible and if possible close to IFA is because governments have to make this a difficult choice, right? To invest in MMS in a sustainable way. And if a manufacturer goes online and then it's very expensive, chances are that they close down a couple of years down the line and then the supply chain breaks and then we are back to where we started.
Yeah, so we have to have a compromise, and our compromise is sort of looking at more of a regional approach, because that does help, particularly we know that in places like Asia and Africa, a regional purchase where we have a shorter logistics chain and also maybe some nice trade relationships going on, that actually, it's not local, but it really offers some good benefits that they can still leverage those countries.
Okay. I want to check whether Kirsten from the Philippines is able to ask her question or his question to the presenters. Otherwise, I will read it out. Kirsten?
Hello. Yes, sir,
go ahead.
Martin. Thank you. Good evening, everyone. So I'm from the Philippines and I'm a bit new in this theme of work. So pardon if my questions are unclear or incorrect. So my first question is, during our work, I heard that there's a move or advocacy to mandate all MMS to be USP verified. I'm not sure if that's a correct term, okay? So I understand the value of quality assurance. That's just what we discussed a while ago. But at the same time, USP verification, if I understand it right, costs manufacturers much every year. And one of the responses we see working with manufacturers to be able to get in the Philippines is that it discourages them from entering the market because it drives the landed cost higher. So my question is, what are alternatives or what can we do to help prevent this effect, both discouraging the manufacturers and driving the final cost higher? I have another question, but I think I should ask one at a time. Thank you.
Thank you. Yes, I mean, we've at UNICEF, we're working with USP, and they do have a very good program for MMS. And in certain circumstances, it really does enable local manufacturers to reach the right standards. So in certain circumstances, that program is really a really good benefit. UNICEF, we actually worked with USP specifically on their verification program for MMS, and we are essentially applying the same program. And at this stage, we don't charge manufacturers. So the catch is, though, that we don't have sort of like a separate program to qualify MMS. We only really do that when we have a tender. So we've actually just finished a tender, and so we invite anyone can apply, and then through that process of application through a tender, my technical team and also our quality assurance team, including the auditors, they take a look at those manufacturers and then they support them to get them to the right level. So that's sort of, so from if you want to become a UNICEF buyer, you don't have to do the USP program. However, if you want to access other buyers, then you might need to do the program. So that's sort of how it is.
Kristen, feel free to go ahead with your second question.
Okay, thank you. So here in the Philippines, there's a motion from our government to categorize MMS as a prescription drug. And yeah, so currently it's a supplement, but they will be updating the guidelines to require MMS manufacturers to have it pharma grade or as a prescription drug. And if I understood it right from the conversations, it would be more difficult to get a certificate of product registration for the manufacturers. Like currently now they're having difficulty because our local FDA have different standards to the UNIMAP standard. So that would add another layer if it would be a prescription drug. So I'm thinking, what are the situation in other countries? Like, is MMS also a prescription drug? Is the benefit of categorizing it as such outweigh the costs or difficulties that it poses? And is there any global guideline that we can use to advocate to our government to a regulation to just keep it as a supplement so that we don't make things more complicated as it's already now in the Philippines? Thank you.
Thank you. These are really,
Alison, as you respond, just noting that Ethiopia is highlighting that they are also facing the same issue.
Yeah, okay. Well, let me.
We are also having a similar issue. We tried. We are like from MSI Ethiopia, so we're leading. We're trying to assist the government in the national scale up of MMS, and we registered a product as a supplement, and then just a month ago, the ministry launched a guideline mandating it to be registered and be procured as medicine, which is going to be another lengthy process in getting the certification, including the GMP. So we have basically stuck because in just 2 weeks, we were about to have a national launch and a kickoff meeting. And this has been very weird recently. So I want to have your view on this. Thank you.
Yeah, okay. Now, I have to say that this is a really important topic, and we've done quite a lot of work on it because we knew that there would be some issues, because with products like this, the nutrients in a tablet across the world, there is no one standard of how to regulate those products. In the US, in Australia, in Canada, in some other countries, they're called dietary supplements. But it depends on the regulation, as to the dose, or the ingredients can like take it down one path and not the other. And in medicines, we also have several categories of regulation. For example, a medicine can be an over-the-counter medicine, which means that it has a lower level of regulation compared to prescription medicines, which need more oversight. So we have documented, we've actually got a big spreadsheet that we developed that has lots of different countries' regulations. And that, I think, is really going to be helpful for those discussions, because governments that are not sure what to do, we can probably share with you, this is the information that we have on this country, that country, and these are the deliberations that have helped them make a decision about how they regulate the product. But what we can say from UNICEF's perspective is that if you regulate it as a supplement, you're not going to get the quality that we can see is required. If you regulate it as a over-the-counter medicine, you'll be able to get the quality that's required. My personal opinion is that it doesn't need to be a prescription medicine, because it's not a treatment. It is a preventative product. It's not going to kill anyone if you don't have the right dose of nutrients in the products. So, but it really has to be taken, like, this is a long conversation, and it needs to be sort of taken as a separate topic with those national governments. And we're really happy to support with that if it would help. So we actually have like a specialist who's really been looking into this regulation area specifically, and I would be really happy to connect Ethiopia and Philippines with our team so that we can, help in that way.
Thank you, Alison. Back to Gemma, there is a question from Hamad Durrani, who is asking whether the dashboard gives MMS distribution in the next 2 to 3 years to specific countries. That is any forecasting.
Yes. So so indeed the dashboard at the moment is a short-term looking forward into what is going to be delivered in the short term, and it is looking backwards, but we are not yet in a position to make it looking really forward, right? So at the moment we are collecting forecast information from the countries that is both in terms of their objectives of target women and the need in general, and we are collecting information in relation to what type of products or what degree or what quantities of products the governments are expecting to be able to procure or to be able to receive, so that we can use it from a supply perspective with the manufacturers. But at the moment, we don't feel that we are yet in a position to publish this information. So we're not publishing it at the moment.
Thank you so much. Alison, another question to you regarding the documents. What's the difference between this document that you presented today and the expert product consensus published in 2024? And will this now replace the ones of 2024, or will there be another iteration of the expert consensus document? I'm glad to see that John Atwater, who with colleagues worked hard on the expert consensus, is also in the room.
Yeah, thank you. Actually, we worked a lot with John. What we didn't want really was to have the expert consensus and then also UNICEF standards separately. It was causing a lot of confusion, and so we agreed that we would align in this these new publications. So yes, it does have the UNICEF logo on there, but let everyone be reassured that it is Kirk Humanitarian and his team who have worked really hard on that expert consensus. We are really, as a team there, we work together, and those UNICEF technical requirements, those standards, as well as the spec, they represent everyone's inputs and they represent the harmonized standard.
Thank you so much. So we are almost at time, and so I'm looking at whether there is any other question from the team. Just double checking. Right, so before we close, I want to now come back to our speakers for your closing statement, if you have any, or thoughts that you would like to leave us with as we continue with this conversation about UNIMAP data visualization, the dashboard, but also about the standards. First, we go to Gemma and then to Alison.
Yes, thank you. Thank you, Martin, very much. And thank you everybody for this live conversation and for this interest. I would encourage everybody to, or those interested, to have a look at the market dashboard. It is live, so it is being updated every day. Of course, nothing is going to so much change on a daily basis, but you're going to see how the deliveries are happening on a daily basis. And also, if you find, as some colleagues were saying, that you are missing some information and that you would like us to expand in another direction, please do get in touch with us. And also, along with the page of the MMS, there is also other resources, the ones that Alison has been referring, and also other market information that is there. So hopefully you will find these resources available. They are really for public use. So we'll look forward to you using them and to you getting back to us if you find that something could be done better or differently. Thank you.
Thanks, Gemma. And I want to just say it's been a pleasure to be with everyone here today. And we do have some links that I think Martin is going to share, both to the two documents that I presented on today, the specification and the technical requirements document. And we also, in addition to that, we have a really great collection of manufacturers' resources, which I really would encourage anyone interested in the supply-related details. We've collected everything in that one website. So I really want to make sure that you have access to that as well.
Thank you so much. So, colleagues, as we close today's webinar, I want to leave us with one central message. Accelerating access to UNIMAP MMS is not only about increasing supply. It is about building confidence, consistency, accountability, and ultimately impact for women and newborns everywhere, and especially in low and middle income countries. So now today's discussion has highlighted two really critical pillars towards that effort. First, we heard from Gemma about the power of data, visibility, market intelligence, and UNICEF has provided public good and interactive MMS market dashboard. It's a rapidly evolving global dashboard, and it will continue to be improved. There's more data available there to everybody, from manufacturers to implementers to governments, donors. You can be able to make better investment decisions if you are a donor. You can be able to plan better if you are a government. Partners can be able to coordinate better with their government partners. And most importantly, you can be able to ensure that pregnant women are not left behind because of fragmented information or weak forecasting systems. So that question that came towards the end was really timely. Then second, we heard from Alison, who reminded us that scale without quality is not success. The introduction of strengthened UNIMAP MMS product quality standards is a major step forward for the global nutrition community. Quality standards do really create trust. And this trust is trust among governments, among healthcare providers, among procurers, and ultimately the women who will depend on these products during pregnancy. I'm reminded of one partner who has always insisted that as we advocate to give women a product that they're supposed to take every day for a whole 9 months of their pregnancy, we should really make sure they are taking something that will help them and not just a substandard product. So this is why this conversation is very important. Regardless of where this woman lives, she has to have access to safe, effective, and high-quality MMS. And what we are seeing now is the maturation of this MMS ecosystem. We have moved beyond asking whether MMS should be implemented. The evidence is strong, the momentum is growing. Countries, as we have heard from the Philippines and Ethiopia, are moving toward the more practical questions on how to implement MMS effectively, sustainably, equitably, and at scale. So these initiatives, such as the dashboard and product quality standards, they do matter deeply, and they are foundational building blocks for long-term country ownership and sustainable delivery systems. Therefore, on behalf of the organizers, on behalf of UNICEF and HMHB, thank you to our outstanding speakers from the UNICEF Supply Division and to all participants who took the time to join us today. from across all regions and sectors. Your engagement reflects the growing global commitment to advancing maternal nutrition and ensuring healthier pregnancies and healthy futures. This presentation will be available for you to review later, and all the links to the resources that were presented today are available for you to download and share with your government departments. So at this stage, I want to thank you for joining us, and we look forward to the next Coffee and Chai Chat and working with you to improve the lives of all women and children worldwide. Thank you and goodbye.
Thank you.
Goodbye.
Thank you. Goodbye.
Thank you. Goodbye.
Bye.
Thank you and goodbye.
Goodbye. Thank you.
Goodbye.